South Carolina is facing a serious public health emergency, a rapidly spreading measles outbreak. Once nearly eliminated in the U.S., measles has surged back, overwhelming local health resources. As of January 19, 2026, confirmed cases have soared to 558, with 124 new cases in just the past week. Spartanburg County is the epicenter, with hospitals under immense strain. The outbreak has already spread to at least 3 other states, turning a local crisis into a regional threat. This rapid escalation exposes vulnerabilities in our public health infrastructure. Communities are struggling daily, and healthcare workers are exhausted. The urgent challenge: contain the outbreak and understand how our defenses failed. The outbreak is hitting children and teenagers hardest, with many young people facing serious health risks that can disrupt their lives in ways most adults may not realize. For many families, the fear and uncertainty are overwhelming as parents worry about their children's safety and well-being. The virus is spreading rapidly, especially among those in schools and daycare centers, where close contact makes it easy for measles to move from one child to another. These are places where children should feel safe, but now they have become hotspots for transmission. Most cases are among the unvaccinated, highlighting the critical role of childhood immunizations. Without protection, children are at risk not only of getting sick themselves, but also of spreading the disease to others who may be even more vulnerable, such as infants or those with weakened immune systems. The MMR vaccine is highly effective, offering strong protection against measles, mumps, and rubella. But without it, children are left defenseless against a disease that can cause severe complications, including pneumonia, brain swelling, and even death in rare cases. In Spartanburg County, clusters of unvaccinated families have created pockets where measles spreads rapidly. These communities, often close-knit and sharing similar beliefs, are especially vulnerable to outbreaks that can quickly spiral out of control. Public health officials face the challenge of reaching these groups and restoring trust in vaccines. They work tirelessly to educate families, answer questions, and address fears, but misinformation and skepticism remain significant barriers. For affected families, the impact is severe. Parents must care for sick children, often missing work, while siblings worry about their own health. The emotional toll can be just as heavy as the physical symptoms. Isolation, missed school, and long-term health risks become a harsh reality. Children are kept away from friends and learning, sometimes for weeks, and some may face complications that last long after the outbreak ends. The community faces school closures, disrupting education and daily routines for hundreds of families. The absence of normalcy is felt everywhere, from empty classrooms to silent playgrounds. Canceled events and gatherings follow as officials try to halt transmission. Sports, performances, and celebrations are put on hold, leaving children and families isolated from their support networks. This outbreak is a direct result of failing to maintain high vaccination coverage. When too many people go unprotected, the entire community is put at risk, and preventable diseases return. Our children are paying the price for that failure. The consequences are real, and the cost is measured in lost childhoods, missed opportunities, and the health of our most vulnerable. Amid the outbreak, a major shift in national vaccine policy has sparked controversy. On January 5, 2026, Secretary of Health and Human Services Robert F. Kennedy Jr. announced a dramatic reduction in the recommended childhood vaccine schedule, from 17 to 11 vaccines. While the MMR vaccine remains on the list, the policy change has sown confusion and doubt among parents. Experts warn that reducing recommended vaccines, especially during rising vaccine hesitancy, is dangerous. The timing of this shift risks undermining public trust in all vaccines. The new policy creates uncertainty, making it easier for preventable diseases like measles to return. South Carolina's outbreak is a stark example of these consequences. Robert F. Kennedy Jr., now leading U.S. public health, is a longtime critic of vaccines. He's used his platform to question vaccine safety, despite overwhelming scientific evidence to the contrary. His appointment alarmed public health experts who feared it would erode trust in immunization programs. The recent vaccine schedule overhaul is seen as the realization of those fears. Most medical professionals view this move as dangerous and rooted in ideology, not science. Kennedy's history shapes the current crisis, a reflection of skepticism toward proven public health measures. The recent outbreak in South Carolina is not an isolated incident but rather the result of steadily declining vaccination rates over the past several years. This troubling trend has been quietly building, putting more and more people at risk. Since 2020, MMR coverage has dropped nationwide, leaving entire communities increasingly vulnerable to diseases that were once nearly eliminated. The decline is visible not just in numbers, but in the empty seats at clinics and the growing concern among healthcare professionals. In some areas of South Carolina, childhood vaccination rates have fallen to just 82.5%, far below the 95% threshold needed for true community protection, also known as herd immunity. This means that even those who are vaccinated are at greater risk when so many around them are not. With so many unprotected individuals, a single case of measles can quickly ignite an outbreak, spreading rapidly through schools, playgrounds, and public gatherings. The virus finds easy targets wherever vaccination rates have dropped. Vaccine hesitancy, fueled by misinformation, fear, and a false sense of security, is a major factor behind these declining rates. Many parents are exposed to misleading information online, making it harder to separate fact from fiction. The COVID-19 pandemic also played a significant role, disrupting routine immunizations as clinics closed and families postponed appointments. This interruption widened the gap, leaving more children unprotected than ever before. When vaccination rates fall, the entire community's defense weakens. It's not just those who skip vaccines who are at risk. Everyone, including the most vulnerable, faces greater danger. The outbreak is a devastating demonstration of how individual choices can have far-reaching consequences for public health. Each unvaccinated person increases the risk for everyone around them. Infants, the elderly, and people with weakened immune systems are especially endangered. They rely on the rest of us to help keep dangerous diseases at bay. The lesson is clear. Low vaccination rates open the door to preventable tragedies. Protecting our communities starts with each of us making the choice to vaccinate. Herd immunity is crucial to stopping measles, a virus so contagious that 95% of the population must be vaccinated to prevent outbreaks. Measles can infect up to 18 unprotected people from a single case, making it one of the most contagious viruses. The U.S. fell below the 95% MMR threshold in 2021, compromising national protection. Even a small drop in vaccination rates creates enough unprotected people for outbreaks to take hold. In South Carolina, rates as low as 82.5% have allowed measles to spread unchecked. Herd immunity isn't just theory, it's what keeps communities safe. Losing it is why measles has returned with such force. The solution is clear: restore high vaccination rates to rebuild our shield. Across the country, medical experts are sounding an urgent alarm. Unless vaccination rates increase quickly, the current outbreak is likely to spiral out of control. Doctors, nurses, and public health officials are united in their message. This is a preventable crisis, but only if action is taken now. The stakes are high, and the consequences of inaction could be devastating for communities everywhere. Dr. Helmut Albrecht, who has been treating patients on the front lines in South Carolina, warns, "We have lost our ability to contain this with the immunity that we have." He and his colleagues are seeing firsthand how quickly the disease can spread when vaccination coverage drops below critical levels. Once measles gains momentum in an under-vaccinated population, it's extremely hard to stop. The virus can move rapidly through schools, neighborhoods, and entire cities, putting vulnerable children and adults at risk. Pediatricians and public health organizations nationwide echo these concerns, emphasizing that the resurgence of measles is not just a local problem, it's a national emergency that demands immediate attention. Many experts point to declining vaccination rates and confusing, sometimes contradictory government messages as key factors that have undone decades of progress in disease prevention. Parents are left uncertain, and misinformation spreads faster than ever. The outbreak, they say, is a predictable result of eroding trust in vaccines and public health institutions. When families hesitate or delay vaccinations, entire communities become vulnerable. Social media misinformation and conflicting advice have only made matters worse, fueling doubts and fears that put more people at risk. Experts warn that if these trends continue, other preventable diseases, like polio and whooping cough, could return, threatening to reverse the hard-won victories of modern medicine. Their plea is clear: we must return to evidence-based public health practices, guided by science and proven strategies, to protect our families and communities. Listen to the science. Trust the experts and take action before more communities suffer the consequences of preventable disease outbreaks. The time to act is now, before it's too late to protect those we love. South Carolina health officials are making an urgent plea: get the MMR vaccine now. Emergency vaccination clinics are being set up in schools and community centers. Parents are urged to check their children's immunization records and get them vaccinated immediately. The MMR vaccine is safe, effective, and the best defense against measles. Adults should also verify their vaccination status, especially if born after 1957. Boosting adult immunity helps close community gaps and stop the virus's spread. Every vaccination helps rebuild herd immunity and protect the vulnerable. Health authorities stress vaccination is the key to ending this outbreak. The window to act is closing fast. The South Carolina outbreak is a wake-up call for the nation. The first step: prioritize vaccination. Parents, talk to your doctors and ensure your children are protected. Communities must work together to promote vaccine confidence and counter misinformation. Local leaders, schools, and health departments should make vaccines accessible and information clear. National leaders must recommit to science-based public health policies. The recent vaccine schedule changes should be reviewed by independent experts. Restoring trust in public health institutions is essential. The challenge is social, not scientific. We have the tools to prevent measles. Reject misinformation, embrace science, and invest in public health. Let's make this outbreak a lesson learned, not a sign of things to come.